For the Young at Heart is sponsored by Duville Life and Wellness Community, a commitment to care, a legacy of compassion. This is Duville.
Hello, welcome to For the Young at Heart. My name is Lucille Jerome, and on today's program, we're going to be taking a look at visiting your healthcare professional. My guest today is Susan Gisome, and she's been a nurse for over 40 years and is currently teaching at the Massachusetts General Hospital School for Healthcare.
It's the Massachusetts General Hospital Institute of Health Professions.
There you go. There you go.
Okay.
I'm so glad you were able to come here. That is quite a long title, but it's
is.
important to get it correctly, so
is.
thank you.
Yeah, you're welcome,
Thank
Lucille.
you. I'm so glad you came today. There's so much going on with our older adults and visiting their healthcare professional. And what are some of the tips that you can give us to help them make those visits not quite as stressful as they can be? Okay?
I think it's so important that as an older adult that you have all of that information down pat so that you feel comfortable, your provider feels comfortable, and when you work in that collaborative role with your provider, then everything seems to flow much easier for the patient, and their care seems to stay right on track. They're up to date with what they need to be. And I'm sure as we go along in our conversation, we'll speak about how we involve family members, whether it's a spouse, an older child, a daughter or a son, or a good friend that's helping to be engaged in your care.
Those are all very important. Those are very important variables that you just mentioned. How do you involve a family member? Should you involve a family member?
Right.
As an older adult.
Yep, I think that's so important, even whether it's any age of the lifespan, but especially as an older adult, because sometimes we lose communication with the community or with our neighbors or with friends because there's either a mobility issue or we're not going out as much. So you want to be able to verbalize to people who are close to you what are your healthcare needs, what's coming up, what's current, so that these people can offer a helping hand for you to make sure that you're flowing along in your health care.
So it would be all right then to bring one of them with you.
Yeah, most definitely. I think it's very important. I know working as a provider for many years in family practice, I always welcomed having a family member come along, especially with an older adult. Sometimes when you're just coming in as a new patient, you're establishing care, it's important for someone else to be there listening to the conversation. There may be a level of anxiety you have coming in as a new patient to establish care, and we don't always hear everything that's being discussed or everything that's being presented. So if you have either a spouse or one of your adult children with you, a good friend, they're listening. Perhaps you may even want to take notes during the visit.
Yes.
Sure.
Taking notes. That's not being rude
No.
to the healthcare professional. It's helping you to remember. And they're
Yes.
the doctor or the nurse, they're going to understand that.
Yes.
They will understand.
Yes,
Okay.
that's all part of what we do in our practice. And in fact, we welcome people. I have had patients who've actually used cell phones to record certain parts of information or to take little notes. So when they go home, sometimes they're just jotting down brief words or phrases that can help them to remember. Pick up my prescriptions, make my visit with these specialists, when will I follow up for my routine care? But it's all important and valuable in keeping their care on track.
Okay. Now, many families are moving around now.
Yes.
Some of our older adults don't have family or maybe even close friends living close by. What would you recommend in that case?
Yeah, you want to look first at your circle of family and friends, but if
Okay.
that's not available, you do want to advocate for yourself, and you want to see who in the community can go with you. You may be working with some of the outside communities, such as visiting nurse or home health aides, and you might be able to go to these agencies and say, do you have someone there who can advocate with me, who can
Okay.
come with me, who
Okay.
understands a little more with the health care that will help me to get through my visit and do it well. And that's always a possibility. The senior centers, I think, are a wonderful facility also, where you may find people who can be advocates.
Right. Many of them have social workers
Yes.
now working in the
Yes.
center.
Yeah.
And I'm assuming that they can go with one of the members, perhaps.
They can certainly ask.
Ask.
I think that brings up the issue of privacy and transparency in healthcare today. With HIPAA laws, there's always everything goes back centrally to the patient. So it would be what the patient would like to have done for them. So if they want to give permission for someone else to hear what's going on with their health care, to be available to the information going into their health care record, it is the patient who would sign for that
Yes.
and say to the providers and the staff at the healthcare office, I would like to involve this person in knowledge of my health care. And so we have forms that they would sign for
Well,
that.
I'm thinking perhaps if the health care advocate, the health care provider, has
Yes.
the form with them.
Yes.
And bring that person wherever possible.
Yes. Yeah.
Okay.
That's very beneficial
Okay.
to have that.
Yes.
Oftentimes I have a group of elderly patients or older folks. They'll come in, and I do see consistency to who comes with them,
Okay.
which is really nice. It may be a daughter, maybe a son, it might be a sister or a brother who is near their age, but they're very close with, and they're
Right.
bringing them in with them. So, and that works out really well for the patient.
Okay. So far we've said something like, when possible, have someone with you.
Yes,
Maybe take notes.
yes.
Maybe, what about making a day of it, making it an event?
Yeah, I think that's a wonderful idea. It really is a wonderful idea. I think if I can put in a little note of a personal
Sure,
interjection.
sure.
I have an older mom, and when I take her for her routine PCP visits with her primary care, which run about every 3 or 4 months, we make a wonderful day of it. So we go later morning, she has her visit, then we do a little bit of shopping, and we stop for a little bit of lunch. And I think it's a nice time
Right.
for both of us. You spend a
Yes.
little time together, and then she feels, I think, much more comfortable and satisfied with her visit to the PCP, and then you enjoy the time together.
Right. It can be unnerving.
It
for
can be.
some older
It can
people.
be very worrisome,
Yeah.
and I see this with many folks, even to the point where you can see that there's visible upset sometimes, either anxiety or even a little bit of shakiness. They're just not sure. But I find that once I say to someone, let's write down a few things you're concerned about.
Yes.
So oftentimes when they come back on a return visit, my patients are good. They will have their little list with them. There may be 5 or 6 items. There may be only 2 or 3. If I can address all 5 or 6, I will. If I can't, we prioritize together. And I say, let's talk about the top 3. What's the vital items we need to address? We do that, and then we set up, okay, now you still have a few more concerns. We need to address these as well. Let me see you in 2 weeks. Let me see you in 4 weeks, if need be. Sometimes the other items could actually be shunted out or sent out to a specialist,
Yes.
someone who needs their routine eye care. Or if I notice that an older adult is all of a sudden, they're not hearing as well, and I can assess that during the visit, then I might say, look at their list, and they've also said, I'm having difficulty hearing. The TV's up louder. I'm missing some of my phone
Yes.
calls.
Yes.
Then, Lucille, I'll say to them, let's set up an appointment for you to have your hearing tested. We'll send you to this specialist. Then, after you see them, you can make your way back to see your primary care provider.
So it can be very orderly,
Yes.
all right?
Yes.
Which automatically reduces stress.
It does. Lucille, I find that once people feel like I'm keeping in order in what I need to do to keep myself healthy and well, I think another key part of keeping things orderly is if they keep a little notebook for themselves where they keep a list of who they've seen for providers, when they go in to see their primary care. And if you have that book to refer back to, it helps both the patient, it helps the provider. You can bring those books right with you, that little notebook with you. And it also helps either the family member, the patient advocate, or the friend who's helping you. Because they can look back and say, oh, you're overdue. You haven't seen your primary care provider in 2 months. Let's make sure we call and put that appointment on your calendar.
Makes sense. Makes sense. Now, many offices are now sending reminders out or telephone calling
Yes.
with reminders.
Yes.
Okay, so that's one way of doing it too. But then, of course, you have to use the phone or
Yes.
however they're doing it.
Yes.
Some are also using the computers now.
They are.
Now, some of our elders aren't computer savvy.
Right. So you want to be sure you know where your patient is
Right.
at. You want to know what type of avenue of communication your patient prefers. Sometimes what happens is I will have either another family member, if it's a daughter, or maybe a younger sibling, a younger brother or sister who is a little more computer savvy. What happens is they will send them an email or a communication. Another thing that people are using, because so many people have cell phones now, is they will receive a text.
Right.
So I find that a good part of our older population is very savvy with that.
They're very much so now.
And they're enjoying the text. And there's usually it's sent out anywhere from 24 to 48 hours prior to the visit to remind you that your appointment's coming up with your primary care provider, date and time. And you will text back yes or no whether or not you'll be able to make that visit.
right.
So it works well.
It does work well. It
Yes,
does work well.
yes.
What about bringing in your medications?
Very important.
Okay, and it's
Very
really
important.
not just the medications,
No,
is it?
no, it's not
Explain that
medications.
piece. Explain.
Extremely important. Good point, Lucille. It's important that as providers, we are aware of every medication you're taking. That means prescription medications from any of your providers, whether it's primary care specialists, or if you're taking any type of supplements, whether they're over the counter, something that another provider recommended, something a friend may have recommended.
Yes.
So you need all prescriptions over the counter and prescribed, and you need to know all supplements. They're doing a lot of research and studies now looking at interactions between medications and supplements. Many of them are very good, and they're not causing a
Sure,
problem.
sure.
But there are some conditions, healthcare conditions, and some cases where you would not want to be taking a supplement because it may interact with the particular medication you're taking.
Could you give an example, maybe just one example
Sure.
of something that could cause a problem?
Sure. There are some chemotherapy agents that people are on for a period of time. If a patient is being treated for cancer and they're on a particular chemotherapy protocol, there are some supplements that are considered very good. They're pycognagels, they're anti-inflammatory type of supplements, but they can block the effects of the chemotherapy, and you don't want that happening.
Okay.
Later on, once the patient has done their chemotherapy and it's fine for them to go back to those supplements, once they've had clearance from both the oncologist, the medical oncologist who is treating the cancer, their primary care provider, and then the patient, so everyone is aware of
Right.
what the patient's taking.
Right.
But that is, one instance
Right.
that it's very important to say, is it safe for me to continue? They're good supplements, but yet at a time with certain meds, it could block the benefit of the medication.
Some people are sometimes we think they don't socialize, the older part, but they do socialize. And they always have a friend or a best friend or another friend, and they get together and they talk about what's working for me versus what works for you.
Yes.
And, well, if it's working for me, why don't you try it too?
Right.
All right? Not a good idea.
No, not always the case. That's correct, Lucille. It's not always
Okay.
the case. You need to look and see what is your particular individual needs, what particular diagnoses that you may have on board, and what will work best for you.
Right.
So I think people are so well-meaning. We all
I
are.
know.
We all are.
We all want to help.
Sure.
Everybody.
Sure. But you just have to say, thank you for the information, but I'm going to take that back to my primary care provider.
Yeah.
So whether you're speaking with your physician or your nurse practitioner, letting them be aware that this is what was suggested for me to use, how do you feel about that? And as a provider, what providers generally will go by is what's called best practice, evidence for best practice. So we look at the current evidence that's available, look at that case, see what the patient would like to do and say, well, in our best opinion, in our best knowledge base, this is what would be best for you.
Right, right.
Right.
And then the next step would be to follow the instructions of the doctor.
Yes. Yep.
You know, play around with it. Well, I'll
Right.
skip this one for today or something.
Right.
Okay, so a little bit of that sometimes happens too.
Right.
But again, you know, life ends up being so complicated for
Yes.
many of us,
Yes.
not just our older adults, for many
Exactly.
people.
Yes.
So sometimes you
Yes.
might forget this or forget that. The wonderful pill containers that are out there are wonderful
Excellent.
assets.
Excellent.
Wonderful assets to help
Excellent.
out.
Yep.
You know?
And you know, you can do those weekly or you can do those and set them up for a month. Sometimes the beauty of using the month-long pill cases is that you can see when you're getting near the end and when you need to call for your refills. It's so important to make sure that, you know, a week or two before, as long as the insurance allows you to do your refill, that you have enough medication on board, especially in the different seasons. You know, winter, sometimes you have a snowstorm, elderly person is not able to get out. You don't want the patient who is the diabetic, who needs their diabetic medications, to run out. You don't want the hypertensive patient to run out of antihypertensive medications. So you just want to make sure you're aware of that. And by using those pill boxes, it gives you an idea of where you're at.
So much good information.
Good,
Thank you.
yeah. Oh, you're welcome.
I have a question about a new medication. Some of our older adults don't really ask questions, even now. Even if they've got a friend with them or a family,
Yes.
they don't ask questions. There's a new medication. It's okay to ask the risks versus the benefits.
Yes.
All right?
Yes. Yeah.
How do we encourage people to know that that's an all right thing to do?
Yeah, it definitely.
You're not really questioning or
No,
undermining
no.
the medical
Yes,
profession.
by no means you're not undermining your provider at all. In fact, I would venture to say that most providers, when they're giving a new medication, I know for myself, I will sit with my patients, I will say, here's the list of your meds. We're going to take this one away, but we're going to add this one in because this is what this is going to take care of in your healthcare need. Let's go over some of those risks and benefits. And I will actually sit with them and go over that. I can either bring up that information on my laptop, I can look at it in my prescriber's reference, I sit next to my patient and I say, this is what you need to know about it. Oftentimes what happens is when you pick up a prescription at the pharmacy, by law, they're going to give you a list of
Yes.
every possible side effect.
Yes.
And they will also list what the medication's used for. But your provider, whether your physician or your nurse practitioner, they will sit with you and say, this is why I feel this is best for you. But please let me know if you have any of these side effects that are more prevalent. You need to give the office a call to let me know. You need to stop the medication. In some cases, some medications should not be stopped immediately. So you want to always reach out back to your primary care provider, let them know, have a conversation with them, and see what's the safest way of stopping your medicine. But I would want to give the message that don't be so frightened when you read about all of those side effects, because the providers do take time to think, how will this best work for my patient? And you, as the patient, need to say to your doctor, I have questions about this, so let's talk about it.
Because when you do pick up the prescription and you do see the fold out with
Yes.
all of the possibilities,
Yes.
well, my doctor or my nurse they didn't tell me this. So why didn't they tell me this? Because this is going to happen. It's not necessarily going to happen.
Exactly, exactly. What they have to list is they do research and study
Sure.
on all these meds.
Sure.
So any potential or possible related event that happened with the medicine needs to be reported. And it may not even have happened more than once or twice,
Right.
but yet it needs to be recorded so people are aware this could potentially occur. So don't be afraid to ask questions about your medicines. Very important, very
So
important.
becoming an advocate,
Yes,
becoming your own advocate,
Yes.
and bringing an advocate
Yes.
with you.
yes,
Okay.
very important.
Okay.
Very
Now,
important.
some of our elders, but we're focusing on elders,
Yes.
but those who are handicapped, they might need a handicap parking.
Yes.
Or maybe they go to the appointment using one of the buses from a senior center.
Yeah.
Okay? So that could be a way to make sure you get to your appointment.
Yes, it is. It is important.
Okay.
I think most buildings today where providers practice,
Right.
although you have, a variety of places where primary care offices are set up, but many of them are set up for the convenience of all patients,
Yes.
meaning our patients with disabilities and those that don't,
Right.
so that the access to care for that patient is very doable to make sure they get there safely.
Do you want, well, I'm wondering, and I wonder if you wonder, sometimes would it be wise for them to actually bring their medications with them versus just bring a list with them?
You can, and I've seen that happen both ways. Some people will come without the list and just come with a little bag or a box of medications. We generally, especially if it's not a new patient and it's been a patient who's established in your practice, then you also, as providers on their record, we have a list of their meds. But we just want to check and see, is there something that was added in by a different provider or something
Right.
new they're using? So they can bring the list or they can bring the pills. Either will help us.
Okay.
But I always recommend, and I think sometimes when you get those callback messages that remind you that your visit's coming up, very often there'll be a little part of the message that will state, please bring a current updated list of medications
Okay.
with you.
Okay.
So that's helpful.
Right.
And it doesn't have to be a list that comes off a computer. It can be a handwritten note, a handwritten list. Those lists are very important even to have in the home. Should an emergency come up, should someone need to go to the hospital, a family member comes in, it's so important to leave that in an area where your family knows, whether it's tacked up on the side of the refrigerator, put inside a cupboard door, somewhere that a family member knows, gee, this is mom and dad's medicine, or this is my brother's medicine, and I know I can access that list. And also on top of the list of medicines, very, very important is to have a current list of any allergies.
Of course.
Yep. And that's, allergies to medications, to supplements, and to food as well.
And the other thing is, I don't think I knew this 10 years ago, well, longer than that, but you can get an allergy at any age.
Yes, you can.
An elder can pick up an allergy.
At any
All
time.
right.
You can. You
Okay.
can. And it seems, whether it is part of the world we live in and the environment that we're in, it seems that more people are developing allergies. A larger group of patients are coming in with allergies even later in life. So, stay current with that. Oftentimes we think allergies, we think children,
Right.
adolescents, younger adults, and then it's done.
Right.
Not so the case. We can develop allergies at any age.
Yes, I know of someone who developed a poison ivy
Yes,
allergy,
yes.
decided to go out and work in the garden,
Yep.
picked up an allergy,
Yep.
and had done it before,
Yeah.
and never had
and
the
was
allergy.
fine.
And
and
was fine. It was
Yep.
fine.
Yep. Well, we have to keep in mind our bodies are always changing.
Yeah.
The cellular structure within our bodies are changing. Our immune systems change as we go through different stages in life as well. So for whatever reason, the body decides to interact that way with a particular substance or allergen, and
Sure.
voila, there is a new
There-
allergy
there
on
it is.
board. Yeah.
There it is.
Yeah.
Okay. I'm thinking about, we're talking about a partnership here
Yes.
between the patient and the healthcare professional. Talk a little bit about the evolution of that process, because it wasn't always
No,
that way.
it wasn't always that way. It's I'm going to do again a little personal interjection, but I remember as a little girl when my mom or dad would go to the doctors, or when a grandparent became ill, it seems that the physician would speak to the family members and not to the patient themselves. And so thinking that we're going to, so we'll use an example. A grandparent is diagnosed with maybe a colon cancer. Well, they were telling the children of the grandparent, who were adults at the time, but they weren't telling the patient.
Exactly.
And it was common to keep the patient in the dark and let the family know. So there wasn't this level of transparency. And it was all done in a very well-meaning way. It was done in a way to say, we're going to protect the patient. We're going to care for them. We're going to treat them. We're going to give them all the love and care they need, but we're not going to tell them what they have. So today we've come full circle. And it's actually wonderful to see the high level of transparency. So your primary care provider, or any of your physicians, nurse practitioners that are caring for you, they are going to speak with you directly as a patient. And then it's you as the patient who are in charge now. I know what my diagnosis is. Even if it's a tough diagnosis that someone is getting, oftentimes if I receive a test result back and I know that I have to give someone not such great news or not such good news about their health, I will say to them, when you come back and we go over your test results, bring a family member, bring a friend, someone who is close to you, because we're going to talk about this. So though the patient is still in charge, they can choose whether or not they'll bring someone with them.
Right.
But at least the patient knows what's going on full well, 100% what's involved in their case and in their care, what type of diagnosis they have, and the management of that diagnosis.
The management of that
Yes,
diagnosis.
so
Right.
important.
Right.
So important.
Right.
So they are really, it's a very much a collaborative partnership with your primary care provider and the patient. And then the patient decides when to open that door and welcome in other family members to help them.
So we're no longer infantilizing the elder.
Exactly,
They are
exactly.
the one with the diagnosis.
Yes.
They need to be involved.
Exactly.
All right?
Exactly.
And I'm thinking when it comes to that stage, when there is a serious diagnosis, or maybe
Yes.
the progression is rapidly moving along,
Yes.
you might want to have your healthcare proxy there, the one,
Very
rather
important.
than, like, say you have a family of 10.
Yes.
You don't want to bring the one who might not really be listening to you, I'm thinking.
Exactly. Or the one that might be so anxious and emotionally
Right,
attached
right.
that they are not clear in making that decision.
Right.
So when an elder does have that diagnosis, it's actually better to do it prior to that.
Yeah.
It's better to sit down with your families or your social group, your close friends, your close people, and say, who do I want? Think about who do I want for healthcare proxy,
right.
and choose one or two people that you're going to be able to trust.
The trust factor. Do you know something, Susan? We're going to be winding down very, very shortly.
Okay.
We've covered a lot of territory.
We have.
Okay.
It's been wonderful.
Oh,
Yes,
God.
thank
I'm
you.
I'm glad you were
Thank
able
you.
to come today.
Yeah,
Really.
yeah.
And taking notes,
Yes.
bringing a family member or someone you trust.
Yes.
Your medication list.
Yes.
And it's a collaboration.
So
Did I
important.
cover those four? Is there
Collaboration.
anything else?
Yeah, and your allergies.
And your allergies.
And your allergies. And, build that wonderful,
Yeah,
close relationship
yeah,
with your primary
right,
care
right.
provider, and your health will be happier for it.
There you go.
Yeah.
I want to thank you for coming, and I want to thank you for watching today. And until the next time, take care. Bye-bye.
Thank you. Yeah, thank you, Lucy.
Okay.
For the Young at Heart is sponsored by Duville Life and Wellness Community, a commitment to care, a legacy of compassion. This is Duville.